centre of care and attention, research, treatment, and of course the Olivia Newton-John Cancer and Wellness Centre is something that all Victorians and indeed I think many Australians are very, very proud of. The work that's done here to provide clinical care as well as research and a more holistic approach, surgical oncology, radiation therapy as well as all the wellness care as well, is something that we're very proud of. And of course, being at a hospital as we are today, we've taken the opportunity to meet with some clinicians and to thank them for their commitment, for their skill, for their compassion. And of course we acknowledge the work that all of our health team do every single day. They are the best of us, and we're there to support them in any way that we possibly can. I've always had the view that you get more done when you work together. Partnerships are really, really important, particularly when it comes to caring for those in the community who are vulnerable, particularly when it comes to making sure that you provide the best care to patients close to home as quickly as possible. What I think all of us here today know, and right across our country, we all know that every day it's getting harder and harder to find a bulk billing doctor for you or a loved one. So we can admire that problem, we can be critical of others about that problem, or we can do something about it. And that's exactly what today's historic partnership between the governments of Victoria and New South Wales is all about. We will, from a Victorian point of view, we will open a further 20 of our priority patient care clinics, primary care clinics, so that's bringing it to a total of 25. I've already announced 5 of these. I'll leave it to Dom to speak about what's happening in New South Wales, but there will be a total of 50 of these across Victoria and New South Wales. That's hundreds of patients being treated each and every day in those clinics. They will operate 16 hours a day, 7 days a week. They'll be bulk billing for everyone. If you don't need to be at the emergency department, no one wants to be at the emergency department unless they've got critical, urgent care needs. And we know that because people can't find a free bulk billing doctor, the only free place to go for many is to go to the hospital, or to perhaps wait longer than they would prefer to wait, and their condition gets worse and worse. This is just common sense. It's $70 million, it's not a cost, it's an investment in a better primary care system for families, for patients, for communities right across our state. We are in a position to be able to announce a further 10 sites today. They'll all be close by to hospitals, and you've got a list of those, and we'll provide details of the next 10 in coming weeks. These will be open progressively. We'll have them all well and truly open over the next couple of months. They'll operate for a year, and we'll then, I think, be able to do what will be one of the easiest evaluations that has ever been done. This will work because it just makes sense. Instead of going to the free emergency department, you will have a free GP primary care option where you can get all the care that you need as conveniently, as easily as possible. As I said at the start, trying to find an after-hours GP that bulk bills has never been harder, and that's why these important investments will take pressure off our nurses in emergency departments and make sure that patients get the care that they need so very much. Can I thank Dom for his partnership on this, and indeed other areas where we've been working together very closely. You always get better outcomes when you work together, and the 2 biggest states in our nation have got a shared plan to make sure that patients get the best care possible. And it just makes the point, I think, to everybody that when it comes to putting patients first, politics doesn't matter, different governments don't matter, we all have to work together, and that's exactly what we're announcing today. I'm now very pleased to hand over to Premier of New South Wales, Dominic Perrottet.
Well, thank you, Dan. Can I say it's great to be here in Melbourne to make this joint funding announcement between the New South Wales Government and the Victorian Government. Now, as Dan has said, I think when we collaborate and work together more, we can achieve many great things. And we've worked together very closely on pre-K education and that reform, sharing of information. And I think this is an area as well which we really do need to work together to make sure that people in New South Wales and people in Victoria have the best health care possible. And if we can't reform the health system after a 1-in-100-year pandemic, then we never will. And what has become very clear over time, prior to the pandemic and during it, is that there is no health system that is immune from pressure during this difficult time. And importantly, we need to look at new ways of doing things. Now, traditionally, this area that we're announcing today has been in the remit of the federal government responsibility. The Prime Minister at the last election ran on a campaign of setting up urgent care centres around the country. There'll be 13 in New South Wales. This will complement that we already have 5 in place in 4 areas across Sydney, and we will increase that by another 20, so that we'll have 25. Obviously, alongside Victoria, that will create 50 of these urgent care centres to provide support for people, so that when you're in after hours, you have a child who is sick, and as a parent, we all know when your children are sick and you can't see a GP, you go at emergency. We've seen in our state over the last 10 years a 30% increase in presentations in our emergency departments. Now, that is not a unique experience, that is happening around the nation and around the world. So here is an opportunity for 2 state governments, the largest states in the country, to work together in a space that is not traditionally ours. But ultimately, at the moment, we have a federal and state health system that does not work alongside each other, it works against each other. This is not here to pass the buck and shift the blame to the federal government, but we need to work on reform. Currently in New South Wales, we have patients in our hospitals who are past the discharge period, who are in aged care or NDIS patients, over 600. That's the equivalent of an entire Liverpool hospital. So we need to work together more. As Paul Keating once said, don't get between a state premier and a bucket of cash. We're here today with a bucket of cash to address this issue. We want to work with the Commonwealth Government. We need to work together from a state and federal level about reforming the system, not simply saying, well, this is how we've always done things, this is the area, GP network, that's the area of the federal government. The public health system is the responsibility of the state governments. No, we're here today to say we want to do more, we want to improve the health system, we want to provide the best support, not just for our people, our patients, but also for our health workers. Our health workers, who Dan has said we just had the great opportunity to meet with and thank, who have done a phenomenal job during a very difficult 2 years. We want to ease pressure in our public health system, but simply investing in money will not fix it. We need to look at new ways of doing things, and the work that the New South Wales Government and Victorian governments have done together in relation to this program will ensure more support for bulk billing for GPs to make sure that there's less pressure on our public health system. That's good for every single person across our 2 great states. Thank you. I'll take some questions.
Very good. Premier Andrews.
Very good.
Home ground advantage, if you like. When will these centres be operational? Obviously, the squeeze is on now.
Yeah, but look, I think it's important to acknowledge that, yes, there's pressure in the system now, but there's never an easy day in health. There's always pressure. And just like last summer, you would have been brave to predict that we wouldn't finish up with a lot of COVID cases and we wouldn't see pressure in the system then. Of course we did. So these will be opened as fast as possible. We've got 5 opening now. We announced those a couple of weeks ago. We've got respiratory clinics. There's more than 50 of those that are operating. They're already open. So we can do this. It just makes sense. It's about subsidising GPs who frankly can't make a living if they bulk bill, to bulk bill everyone, to have those extended hours and to provide that primary care, the care you need in your community, rather than waiting in an emergency department where, because of the way emergency departments work, the sickest patients get treated quickest. And as a parent, as a premier, as a partner, that's exactly what you want. It's very frustrating. If the only free option is the hospital, well, that's where many families will go. So we'll have them open progressively. We've given you 10 further sites today. We'll have physical addresses for those quite soon, and they'll be open progressively September, October, as fast as we possibly can. And the other key point, Rich, is this. We've asked the health department, righto, give us the data on not just the busiest emergency departments, but the busiest emergency departments where the largest number of patients who really shouldn't be at the emergency department are. So that's why there's a list of 10 there. The second 10 will provide that to you as soon as that further analysis has been done.
And do both states actually have the workforce to...
Yes. This is a really important point. We know, look, the announcements that I made on Sunday is all about the nursing and midwifery workforce, the work that we've done in our budget back in May, all about the health workforce more broadly. You can build lots of new hospitals, that's great, we're doing that, but you've got to staff them. Otherwise, they're just an empty shell. This is about using the current GP workforce, changing the way that they work, making it possible for them to bulk bill every single person who comes in under this program. Interestingly, whether you've got a Medicare card or not. There are some people in the community who don't have a Medicare card. They don't have the benefit of that safety net. we want everyone to be able to get this care for free. Because the other way to look at this, and Dom and I have discussed this many times, the cost of failure is so much higher. If that person finishes up admitted into a hospital, we pay 50%, the feds pay 50%, and it's not 50% of what it costs to see the GP a week or a month earlier. It's 50% of a much higher amount of money, and that bed is then not available to someone whose condition was not preventable. So this is just common sense, and the best reforms always are.
Premier Andrews, this isn't just two states working together, but two parties. How much of a coup is it for you to have the most senior Liberal in the land at your side today to make this announcement?
Well, if it's a coup for him or a coup for me, I'm not sure. It's not really about coups. What it's about is it's about patients. And when it comes to patient care, politics doesn't matter. Politics doesn't matter. And, you know, I'm sure there are things that we don't agree on. I'm sure there's always a bit of that, you know, Sydney-Melbourne rivalry. But at the end of the day, you get more done when you work together. And I couldn't be prouder, for instance, that we were able to make some very significant announcements. We couldn't be together to do it. We made some, I think, incredibly important reforms in terms of economic power for women, productivity, the brain development of our smallest citizens, their life opportunities, the pre-K, doubling 4-year-old kinder, announcements to try and intervene in a broken childcare market as well. It was really significant. And it was stronger because it was the two biggest states. So wherever we get partnership opportunities, I think we're proving to you all that we're happy to seize them. And it's not about the team you barrack for, it's about the people that you serve.
Are you hoping this announcement will be matched by the federal government in terms of more funding for Medicare bulk billing?
Well, I'll let Dom speak to this as well, but let's be very clear about this. And I spoke with the Prime Minister on the way here this morning about a number of different matters. The Prime Minister, who is a Prime Minister who wants to get things done and who wants to partner with us, and that's a very refreshing thing. They've got commitments around 50 of what they call urgent care clinics. I think New South Wales is probably going to get 13 of those. We'll get 12, something like that, depending on you round up or round down. But at the end of the day, that'll take a little bit of time. That government's only just been elected. They've got a budget coming up. I'm sure they'll acquit all their promises, and where they can go further, they will. But what this will do is get people the care that they need when they need it, keep them out of emergency department where they don't need to be and they don't want to be. They want to get primary care. They just can't find a bulk billing doctor to provide it to them. This is the key point here. It's never been harder to find a bulk billing doctor than it is right now. And instead of complaining about it, we're doing something about it. And I think that's a really important thing. Dom.
I think the important point to make there is we're not here to complain. We could easily be standing here saying this is not in our area of responsibility. If this is a challenge that every person, every family right across our state and Victoria and right around the country is struggling with in terms of finding access to a GP. And I believe if you started the Federation again today and put together the current health system, you wouldn't have it the way it's been set up in terms of the federal financial relations between the federal government and the state arrangements. But we need to work to change, and ultimately the best thing that we can do to put downward pressure on the public health system, but also ensure that patients who need it get that support as quickly as possible. Dan made the correct observation that through the triage system, you do have people, if they can't see a GP, they can wait for hours in emergency because the patients with most need to be seen first. And so this is from a state government level, our venture into this space in major health reform to say, well, we will engage, we will provide these after-hour GP clinics. Now, we'll continue to work with the federal government. I did that with the last federal government, and I think as we've said, we'll evaluate these. Once they're up and running, we'll evaluate them. I'm pretty sure I know what the evaluation's going to say. They're going to say they work because we know we've seen the increase in public emergency presentations, and the main reason behind that is because of the lack of access to after-hour GP networks. We're stepping in. We're saying we'll provide extra support alongside the 13 centres that we'll have in New South Wales from the federal government. I believe that will complement each other incredibly well. I believe this will demonstrate the success of this program, and that will lead to further reform off the back of it. And I'm sure Dan and I will continue to prosecute the case with the federal government.
Will you be doing that tomorrow at National Cabinet, urging your other state premiers to look at this model?
Well, I think my experience in the past, and Dan spoke about pre-K, I mean, one of the things that's probably one of the negative aspects of the pandemic was the was the fact that there seemed to be too many disagreements between the states and territories. Now, from my experience and previously as Treasurer, I worked very closely with the Treasurer here in Victoria, Tim Pallas, in relation to a whole range of reforms that we could work on together in New South Wales and Victoria. I found the same relationship to be incredibly constructive with Dan Andrews. And as the two biggest states, as the leaders of the two biggest states, which actually have very similar issues, then working together, sharing information can actually help our people. And that's what we've seen during the pandemic. We've embarked on that, and we couldn't be together when we announced the pre-K education reform, but that is substantial reform. And as a parent, for our young children to have the best educational outcomes and giving them the best start in life, that is substantial national education reform. And in terms of driving women's participation through childcare reform, these are things that if we do together, we might not always agree. There might be different challenges we have in different states, but if we can partner together and work together more, we'll get better outcome for our people. And if other states decide to pursue similar reforms, then we would welcome that.
On National Cabinet, will you push to change the isolation rules tomorrow, and is there a unity ticket on that front as well?
Well, that'll be debated in National Cabinet. I've made it very clear, probably 2 points. One, I do believe we should move from 7 to 5. We'll have our health officials there to discuss that tomorrow. But I also believe in national consistency. I've made that very clear that if we will be better as a country in circumstances if we, on the remaining health restrictions that are in place, that we move as one. We will naturally discuss and debate those things tomorrow, and hopefully we'll have a strong outcome. The other point I would make, which I've made previously, is in relation to the pandemic payments. Now, we've stepped in from a state level and provided 50-50 in terms of those financial arrangements. I do not believe it is right that forced isolation continues and that the state does not provide that financial support. The state, being either the federal government and the state governments, in circumstances where health restrictions are in place that restrict people's liberty, the state needs to provide that support. And the reality is, if that support's not there, what you will have is people then leaving isolation and then working to provide for their families. So we have a responsibility to do that, and I'll make that point very clear tomorrow.
Is Dr. Chan supportive of reducing it from 7 to 5?
Well, that's a matter for the. Obviously, we have these discussions with our health team and with the health minister, but it's always been a balance. It's always been a balance. We look at the health advice, we look at broader implications. We'll have those discussions tomorrow with the federal government. AHPPC has been meeting over the course of the week, and they'll address those issues at National Cabinet tomorrow.
Could I just add that some time ago we asked AHPPC to look at these very questions. So the request came from First Ministers. They posed that question, they had a debate and a discussion, and the answer last time this came up, the answer was no. It was not a good time to do it, and that made sense given the winter peak. In fact, we've not reached the winter peak. I think the time is right for us to get fresh advice, and we'll get that advice tomorrow, and I'm inclined to follow that advice. And part of independent advice, particularly for you guys, is it's very, very frustrating. I can't tell you what that advice will say, because it's not coming from pollies, it's coming from public health experts. So they'll give us that update tomorrow, and then National Cabinet will make one decision. We'll make a decision either way, but no one enjoys isolation. No one wants rules on any longer than they need to be. So there's no difference in our view on that. And just on the pandemic payment, if I can also make the point that from Victoria's point of view, and this is, I'm sure, exactly the same as what occurred in Western Sydney and through lockdowns and things and all manner of other restrictions, if we know through personal experience in some parts of Melbourne, indeed right across our state, if you make people choose between feeding their kids and stopping infections, that's not a choice we should make any family have to make. We just shouldn't make anyone have to choose like that. So if you want the best public health outcome, staying away while you're sick is really important for all of us, takes pressure off our nurses, and much better. But those pandemic payments have worked, and if we're going to continue isolation, then those pandemic payments should continue as well. And a bit like our announcements today, or free kinder and pre-K reform, a partnership with the Commonwealth on that will be much better for everybody.
And just on isolation, if that advice comes into National Cabinet and it is to reduce, it's safe to reduce, we will follow that.
Yeah, I think the point Don makes is very important, that we need to have a nationally consistent approach. We've always followed health advice, and from time to time we've been criticised for doing that. I'm not about to change that now.
Premier Perrottet, have you ever taken a look at Premier Andrews' announcement on the weekend free nursing degrees, etc. Is that something that you're likely to follow suit?
Well, I think what I've certainly learned over the last few years is that we're always sharing policies, and there should be no shame in copying them. If something works, other states should follow. Obviously took notice of that. We just announced just last week a expansion of our scholarship program for doctors and nurses in regional New South Wales. We significantly increased access to those programs to help drive support for our health profession in rural and regional New South Wales. So there's always different issues, but things that we can share and learn from, and I'm always taking an interest in the policies that come up in Victoria. And I think it's a great opportunity to, I strongly believe in competitive federalism, but obviously, New South Wales is much better than Victoria, but maybe not the right audience. But we need to move a lot more to collaborative federalism. And when the Commonwealth Government has jurisdiction, you have a one-size-fits-all approach generally, and the states need to work it out on those areas. Where states have jurisdiction on matters like health and education and the like, we kind of go our own way. But if we can share information, learn from each other, evaluate together, we'll get better outcomes for our people. And I think what you've seen in the last few months from the New South Wales and Victorian government, whether it's education, whether it's childcare and providing opportunities for women, or whether it's our health reform today, I think what you can see is a new era of state governments collaborating together across party political lines, because, as Dan says, this is not about politics, this is about our people.
Are you worried, though, that the competitive federalism might see nursing students from Sydney move to Melbourne because it's going to be free, cheaper to do?
Well, we'll work on that. I mean, that's obviously not, that's not a concern I have. We want to make sure that we provide the best support possible to our health workers in our state, and we know that our health workers have done an incredible job, whether it's in Victoria, New South Wales, or right around the country. We want to attract people. I think what Dan said the other day was 100% right. If you're in Year 12 and you're thinking about nursing, you should do it. We met a student just earlier today who was studying, who's on prac year from her study, and I asked her, why did she choose nursing, and she goes, because I just wanted to help people. And that's exactly what is wonderful about the health profession and about the people who choose it. So we'll always look at new ways of doing things. I think sharing information provides a great opportunity and a new era in the Commonwealth.
Is this a specific New South Wales-Victoria relationship, or are we going to start seeing you make announcements with Mark McGowan and Anastasia Palaszczuk as well?
Well, I'll work with anyone. I've obviously, from my perspective, and Dan might comment, but from my perspective, as previously as the Treasurer for 5 years, I found working with the Victorian government very worthwhile. Working with Tim Pallas on a whole range of economic reforms. During the pandemic, we shared information in relation to financial assistance for businesses, what worked, what didn't, because there were things that we didn't do that necessarily hit the mark. But we had similar impacts in terms of lockdowns. We had similar impacts on our workforce, on our businesses, on our health system. We have very similar states. They're of a very similar size with a very similar demographic. And that means that we can learn from each other, and also a passion for reform. I think the New South Wales government and the Victorian government share that zeal for reform, because in challenging the status quo and the ways of thinking of the past. That's what we're doing today. We're completely changing the way we look at health reform in this country.
Have you had any conversations with opposition leader Matthew Guy, given that he is trying to become Premier in November? Are you talking to him about working together with him?
No, I haven't spoken to him, but I'm here. I'm here with Dan today to not talk about politics, to talk about people, to talk about reform of health in this great country. I'm not sitting here at a Labor Party fundraiser. I'm sitting here with a Premier who wants to get things done and look after his people. We've put up that relationship. We've been working very closely together, and that's important.
Victoria is in opposition of making the issues in Victoria's health system as unique to the state, but you're saying that nursing partners are also facing pressure.
Well, they're not unique to it. They're not. I mean, every state health system around the country and around the world is under pressure. And that is only natural, particularly in circumstances where we've come through a 1 in 100 year pandemic. The issues that we face in New South Wales are not unique to the issues that we face in Victoria. They're all similar. Our health systems are under pressure, our doctors, our nurses, and we need to work together for a better way. I'm very, but having said that, I think we're blessed in this country to have such strong health systems, and we shouldn't lose sight of that. We have, whether that's New South Wales or Victoria, we have the best health systems arguably anywhere in the world, but we need to look at new ways and better ways of doing things. And I think this challenge that we're seeing in Australia through the Federation and the federal financial relations issues that we have is that we have a primary care system working against the public health system, and we need to better integrate. They're not working alongside each other, they're working against each other. Today, New South Wales and Victoria break that down. We say no more, we will get into that space, we will look at ways in which we can engage with the Fed, which is generally a traditionally federal responsibility, and say we want to assist, and obviously once this works, as we know it will, we might have further discussions in relation to finances.
There is a big difference between the two states at the moment. We've got nurses striking Thursday, train strike tomorrow.
Yeah.
What's the difference?
Well, you know, I might give a different answer in New South Wales. I give it in Victoria. But look, people will protest from time to time. In relation to the trains, I've made it very clear. That is a politically motivated strike. It's been ongoing now for a substantial period of time. Every time that we have made concessions to fix that issue, the union has come out and said, no, we'll move on to something else. Now, you've got Labor opposition in New South Wales. It's also said the strikes must come to an end. There's a unity ticket here. There's a unity ticket. And over the course of the weekend on Sunday, I spoke with the Transport Minister and the Industrial Relations Minister, and we said that we'd make those changes to the new inner-city fleet, costing our taxpayers hundreds of millions of dollars. And we would do so on the basis that the enterprise agreement would continue, that work would continue, but no industrial action could be taken in the intervening period. They've said no. So I think we all know what's going on here. I've made it very clear, and the inconvenience, particularly tomorrow to people right across our city, is devastating. Kids won't be able to get to school, parents won't be able to get to work, small businesses in the city that thrive and live off people coming into work, coming into school, lose out. So our people are being inconvenienced and penalised because of this ridiculous action. We've made it very clear our position. We're making modifications to those trains that we believe clearly don't need to be made, but we're doing that as a concession to get the trains on the track as quickly as possible and to ask the unions to actually focus on the people of our great state rather than themselves.
Premier Andrews, what do you make of the article in The Age today suggesting there may be a potential campaign for...
We have provided on the record answers to questions that were posed, and I've got nothing further to add.
Just on the nurses, some experts have said the issue, just on the nurses, some experts have said the issue is not so much the nurse places, but has to be around.
Yeah, look, I saw some of that commentary. I've seen some commentary from leaders, CEOs and others from the private sector as well. We don't employ private sector nurses, they're employed by private companies, so I'm not quite sure what that criticism's about. In terms of clinical placements, the package that I announced on Sunday includes dedicated positions to do exactly that, because when you learn in a practical environment, you need someone, they're often called preceptors, you need someone to mentor you, to bring you along, to supervise you, and those positions are funded, just as they are each and every year when we have a record health budget. When the budget goes up every year, that clinical education, the supervision of those who are doing clinical placements is an important part of it. But the package itself actually funded several hundred of those spots, so I'm not quite sure where that criticism comes from. To your earlier question about will we do this with other states, I think we're going to get an absolutely first-class display of governments of all political persuasions, all different perspectives at this Jobs and Skills Summit. I think this is going to be a fantastic opportunity. And again, the last thing I would ever do is be here speaking on behalf of any other states. They can make their own statements. But we had a Council of the Australian Federation meeting just last week, which Dom chairs, and I think we've got broad agreement on increasing the skilled migration cap, provided there's a permanent pathway to residency, not fly in, fly out. We want people to come here, make a life here, work here, bring their skills here, and maybe we can train them up even further. I think we're going to see some really innovative stuff come out of what will be more than just a group of people sitting around talking. I think anyone who saw Jennifer Westacott and Tony McManus on Sunday would say that's the sort of partnership we need. So I think you're going to see, maybe not as focused as this, but you'll see, I think, governments from across the country all working together with the private sector, with the union movement, with workers, to deliver a much, much better outcomes. Every industry I talk to, large and small, city, country, every sector, they're finding it hard to find staff. And I'm sure it's the same in New South Wales. So there's never been a better time. Prime Minister Albanese is to be praised, I think, for so quickly setting up this really important forum.
Can I just add to that? Also, I think that's 100% correct. So the relationship of the first ministers and premiers through the CAF process has been able to put matters on the National Cabinet agenda, and I've had very constructive discussions with the Prime Minister in relation to the positions that we came together on. And a whole lot of those areas are ahead of the Skills and Jobs Summit. We've had a uniform agreement between the states and territories, and the engagement with the Prime Minister in relation to what we wanted to work on together. He will take to National Cabinet tomorrow. So I think so far that the relationship is very constructive, and ultimately as well, you now have the states and territories playing a leadership role, putting matters on the national agenda, not just having the federation being run from the top down, from the Commonwealth to the states. It's a greater engagement, and we're much better when we work together, and that's what we're seeing today.
What's the number one result you want to see in the summit?
Well, one of the key issues I think that needs to be addressed is obviously the movement to permanent residency for those areas where all the states have identified skill shortages in. So through the CAF process, we have worked together. We've identified where those gaps are. We've provided that to the Commonwealth Government. But one of the challenges is not just resolving the backlog that's there, and I know that the Commonwealth Government has put a lot of resources in Home Affairs towards expediting that work, but ultimately as well, encouraging people to come to Australia in those key areas where we need workforce. I was out in regional New South Wales the other day, meeting farmers who have their produce and their fruit just falling on the ground and going to waste because they can't find the pickers to pick the fruit. We need to get people into this country, and one of the key ways of doing that is fast-tracking permanent residency. That's something we've agreed to as state leaders, and that's something I'd like to see come out of the summit.
This is not my number one, but just to give you an example of some of the things we need to perhaps look at. I was talking to a chef the other day, and he's now a pensioner. He's chef for more than 40 years, worked all around the world. He gets a call, multiple calls every week, asking him to come back and do a shift or two. He can't do that because if he does, his pension goes down by $150, and so does his wife's. He wants to work. He wants to bring on the next generation of people to work in what is a magnificent industry, one that employs so many people and is critical to our visitor economy, to the way we're viewed around the world. Whether we can afford the luxury of penalising people for working, I don't know whether we can afford that anymore, given some of the shortages post-COVID. I think we may have to have a look at some of those rules and give people, whether it be students who come here, greater flexibility to work, people who are on benefits, greater flexibility to work. The notion that we're penalising people and keeping them out of the workforce while every industry is begging for staff, just doesn't make any sense to me. Well, he's much more eloquent than I am. I should have just said that, shouldn't I? But ultimately it's about, if you've got skills, if you've got experience, and it's also about valuing people. If you're a senior Victorian, a senior Australian, you've got a lifetime of experience, it's called wisdom. We should tap into that. Yeah. We should be bringing on the next generation of chefs, engineers, nurses, whatever it might be. If we can tap into that, then we should. We shouldn't penalise people who, just because they're older and are on a part pension or even a full pension, I don't reckon we can afford the luxury of saying, no, you can't work, we'll lock you out, while we've got such skill shortages, post-COVID skill shortages in every single industry. So they're the sorts of things. I know that's not necessarily front-page news, but it's an important thing, and it'll be one of many things that we talk about. And I think there will be a real sense of national unity and purpose coming out of this Jobs and Skills Summit, and the new Prime Minister is to be praised for it.
Premier, case numbers are down and the health unions calling for an end to isolation requirements. Why do kids still need to be masking up in
Sure,
schools?
no. Sorry?
Why do kids still need to mask up?
There is advice around masks. We're wearing masks in here. It's mandatory in health settings. If we were to go to another setting, it would be simply advice. For instance, you'll see the Parliament today, some people will be wearing masks, some people won't. The time will come when that advice can change, a bit like returning to the office. I think I know that's been constantly evaluated. I was talking to some industry leaders yesterday and they're very keen, just as I am, to have the advice that says if you can work from home off, and as soon as it's safe to do that, we will.
Just a quick question on the Safescript program. The fact that we've seen more than 600,000 road notifications this year, does that make the program even more important?
Well, firstly, I'm a very big supporter of this program. I had the great honour of being involved in the development of this in partnership with the Pharmacy Guild, and let's give a big shout out to our community pharmacists who do such an amazing job. One of the most trusted professions. They just do amazing work, and we can't thank our pharmacists enough. So we've been very strongly supportive of this. If you don't measure it, you can't manage it. If you don't have this project stop, this whole system, then you just don't know what's happening out there. So it makes sense. The Health Minister has been standing here very patiently, and I knew there'd be a question that she'd be able to help with, and I'll now ask her to speak to this, to the story that's in today's paper.
Thanks very much, Premier. Thanks very much, Premier. And can I just take this opportunity to say how wonderful it is for you to be here with us too today, Premier Perrottet. Yes, so Safescript program, of course, was implemented by our government back in 2019 and has proved to be really successful. Obviously, what this program does is alert both prescribers and pharmacists to people that perhaps are shopping around trying to get additional prescriptions of drugs that we know, if taken excessively, can cause harm and indeed addiction. So this is sending a message that Safescript is working, the alert system is working. Obviously, I'm concerned about the number of people that are presenting, trying to access scripts for prescriptions that are of drugs of addiction. And this is something that I look forward to talking with both pharmacists and medical practitioners about. But we've got the system in place, it's doing its job. But obviously people with drug addictions and prescription drug addictions is a cause for concern. But we've got the data and that's going to help us to tackle the problem.
Are you concerned there's records being kept of people who are red flagged?
So the red flag is obviously the key piece of reform that the Safescript program has implemented, and it enables a timely conversation between either a medical practitioner or their pharmacist in relation to these drugs, and indeed it fosters greater relationships between GPs and pharmacists, and that is a good thing for the health of all Victorians. Okay, so obviously drug and alcohol addiction, dependency and self-medication are complex issues, but what we have seen is some changes in the drug harms and the drug use in the City of Melbourne. And during COVID we saw a decrease in the supply of heroin that then meant that drug users were accessing methamphetamines. So this has changed the behaviours and indeed the harms, and that's why Ken Lay is taking time to understand what that means for drug use activity in the City of Melbourne. I make no apologies for taking the time to get this right. It's really important that we do so. We know that the safe injecting room, the facility that we have, is saving lives. It is people that are overdosing are having their lives saved, and we remain committed to the delivery of a further injecting facility in the City of Melbourne, as we've committed. But we won't be making a decision about the location of that facility until such time as we've received the important work that Ken Lay is doing for us.
Premier Perrottet, difficult for you to comment on, I realise, the Chris Dawson verdict's being handed down today. Regardless of the outcome, do we need to reflect on and look at the policing of this situation, given it's taken so long to come before the courts?
Well, I'll take the advice of the Attorney General on that, but obviously this is a devastating crime. regardless of the verdict. You know, a parent lost a daughter. You know, these are devastating, horrific crime, and the fact that it's taken so long probably adds even more trauma to the whole matter. But obviously, whatever the court decides today, we'll respect the verdict of the court. But I think if there are ways and if there are issues that have occurred on the path in terms of how this matter has taken so long, well, I'll seek the advice from the Attorney General. Thanks, everyone.
Premier Andrews, are you concerned about potential teacher shortages in the future, which have been raised by the AU?
I have a regular dialogue with the Australian Education Union. They are a proud and effective voice on behalf of the teaching profession and, of course, support staff. We can never forget support staff and the work that they do. That discussion has seen us invest in thousands of extra teachers over our time in office, hundreds of new and upgraded schools, things like the recent enterprise bargaining agreement that actually reduced the face-to-face teaching hours so that teachers have time to prepare, have time to assess, the tutor program that we put in place during COVID and indeed in the aftermath of the worst of COVID, 6,000 I think, or perhaps even more tutors to make sure that individual attention, both for catch-up but also for excellence. All of that comes from our dialogue with teachers and the critical support staff who work side by side with them. So we will continue to work with them. My door's always open. I spoke at their delegates conference just recently and we talked at length.
But do you share their concern?
Well, there's always concerns. As I just said, Rich, again, only a few minutes ago, every industry is having trouble finding staff. So that's why this job summit, it's not just for private sector, it's also for, we're the biggest employer in Victoria, you're the biggest employer in New South Wales. All of us are finding it difficult to attract the staff that we need, and that's why we have to try different things. That's why we have to make sure that we utilise the staff we have as best as we possibly can. And having patients go to an after-hours free bulk billing clinic that we're opening, that's a much better use of the nurses and doctors and AMBO's time, and it's also a much better outcome for patients as well. That's why this is a universal issue. This is happening across our country, and whether it's on this or so many other areas, I think you'll see governments of all political persuasions come together these next couple of days and do what's really important for our country.
She's had her charge of incitement thrown out. She was one of the Freedom Rally organisers. She says that paves the way for other people to have their charges thrown out and says that you should be charged. I'm not sure with what.
Neither am I, Chanel, and I wouldn't be commenting on individual matters. And who gets charged is not a matter for the Premier. It's a matter for Victoria Police and prosecutorial authorities.
Last question, please.
Just back on the campaign meetings with electorate office staff. In one commitment I had been unequivocal that electorate officers doing campaign work could be a misuse of public funds. Has that occurred?
Well, I've been equally clear on the record. Answers were provided to the questions that were asked, and I really have nothing further to add. Thank you all very much. And thanks to the Austin and all of their staff. Thanks, Adam.
Thank you. Feel free to come to Sydney. You're much nicer than the press.